was a time not so long ago you mentioned the C word, and that normally meant a death sentence. But today, cancer is not only treatable, but in many cases curable. Thanks to incredible technology like this behind me and some incredibly experienced oncologists, things have changed in our world for the better. And thanks to places and facilities like Choice Cancer Care, who have not only medical oncologists but radiation oncologists, they will be with you on your journey every step of the way.
We want to give the highest level and service of care that's available to be rendered. And I just like to think if you have high standards and can apply those on a day-to-day basis. So we have the best equipment that's possible to purchase. We have a quality assurance program all throughout everything that we do. I think if you can carry out your affairs like that and maintain focus on the patients have presented us with very significant problems, and we're able to sit down and figure out what's going on, try to put the patient at ease, and help take care of them and cure them.
Every patient we see is different. We see all kinds of patients, from head to toe, like head and neck cancers, lung cancers, prostate cancers. Some patients, they already know about their diagnosis well, but some patients don't really know much about it. You spend a lot of time with them, sit down, and explain to them what is diagnosis, what is their prognosis, what to expect from the treatments, and what is the plan.
When you talk about cancer, there's a lot of fear, there's a lot of trepidation, there's a lot of just not knowing. How do you approach a patient? What do you say to them the first time they come into your office?
I give all the options, that the patient needs to know about their tumor for their cancer, and try to do all the workup necessary to get to the proper conclusion and how to handle the situation.
Basically, my job is to see patients and in some cases make a diagnosis of cancer. And after that, we make a plan or prepare a plan to treat those cancers or those blood diseases. And we do that in cooperation with other specialists. So the medical oncologist is usually the coordinator or the person that is directing much of the care that cancer patients receive throughout their lives. That means we talk with radiation oncologists, we talk with surgical oncologists, we treat patients here in the office with chemotherapy, as well as follow them along after they have recovered from their illnesses.
We treat cancers from head to toes, from soup to nuts. We're in Texas, there's a lot of sun exposure, we see a fair amount of skin cancer. But we're set up and trained to, and we do take care of a whole host of malignancies, multiple myelomas, lymphomas, sarcomas, bladder cancers, pancreatic cancers, all kinds of malignancies. But the most common things that you would see would be prostate, breast, colorectal, and lung cancer. It's a multidisciplinary setting here with radiation oncologists, Dr. Desari and myself, and then we have multiple medical oncologists on staff who are professionals and experts in administering chemotherapy. So we work hand in hand with them to make sure that the patient has a treatment plan and a course given that's easy in one place. We have a very nice, comfortable area for the chemotherapy, and if they need radiation, they just, Doctor, we've got a patient who's got such and such, he needs to, okay, we'll get him in, we'll sit him down, and it's easy for the patient.
So many things that are available for us, like CT, PET scan, we could see the tumors very precisely, and we can target the radiation very precisely to these tumors. That way we can target the cancer cells and not affect the normal tissues around it. So we basically can spare the normal tissues. Most of the time when the patient comes to me with a breast cancer, they're already diagnosed, so they already have the mammograms, they already have the biopsies, and most of the time surgery too. Sometimes we see the patients before they get the surgery done. And we do intensively modulated radiation therapy with the rapid arc technology for the external radiation, and we do permanent seed implants.
Chemotherapy has come a long way today. We have medicines that have less side effects, are easier to tolerate. Some of the drugs that we use today don't cause to lose your hair. We have better medications to treat the side effects like the nausea and the vomiting. We also have other treatments called targeted therapies, and those are actually more modern and even better. Patients that use these agents have less of the conventional side effects, less infections, less problems with nausea, less issues with needs for transfusions. Today we have patients that might be taking a pill every day for the rest of their lives, and that will take care of some of their cancers.
What is it that makes Choice Cancer Care so unique, so special in your mind?
The most important thing about working here in Choice Cancer Care is that you can get the best treatment that you can get anywhere in the United States and anywhere in Texas, but you can get it closer to your home. Cancer is a very difficult disease. These patients need a lot of support, so you get to stay here and keep that family support, keep that personal support. You don't have to be driving or flying many miles just to get your care and then have to come back and be away from relatives.
Susan and I had two dear friends who died of pancreatic cancer, one right after the other. So I thought it was time that we put together a foundation to try to make a difference. People with pancreatic cancer, there are 44,000 Americans diagnosed per year, 39,000 are dead within a year. So we dedicated our foundation for the early diagnosis of pancreatic cancer.
We wanted to speak for those who can't speak after they pass on from this disease. And we felt after losing two of our dear friends that there was very little being done to make people aware of pancreatic cancer. And we were hoping that we could make the general public aware that pancreatic cancer is so lethal and doesn't give the patients an opportunity to prepare for what's going to happen. As soon as they find out they have it, typically within a few short months their lives are taken. And it leaves the family members devastated, and we're hoping for an opportunity with your support to change this. Through early diagnostic research, we're hoping that we can help to lead to find a cure, but help to give the patients a chance to find this disease early and help their family members get their lives together before they're gone. That's very important.
My sense is if you have good people around you, you have a better chance to have good things happening. I started this myself and put really high-quality staff around us, high-quality medical oncologists, dosimetrists, physicists. Our nurses are excellent, the techs, and to be able to track those people, hopefully we've had a good reputation that attracts them. To be able to get really good people around us is one of the most rewarding things. The patients need some comforting, a little love and reassurance. I think you have to practice medicine that way, and we try very hard to do that.